When we assess patients who are violent, it is very important for us to try to figure out why they are violent. Because if it's something that's fixable and we fix it, then theoretically that violence in that patient should decrease. Also, I would not recommend that you do any kind of physical examination on a patient who is violent, because chances are you are going to be involved and they will probably assault you as well. When you are dealing with the violent patient, make sure that you set clear limits so that the patient doesn't feel that they can get out of control. Also, make sure that you warn other people if the patient has made threats. For example, if a patient tells you, the next person that comes into my room, I am going to punch them in the face, then you should make sure that everyone else gets notified so that whoever walks into the room won't be assaulted by that patient. Should the patients become violent, then of course make sure that you use appropriate equipment as well as trained personnel. One of the problems in the United States today is that there's a lot of deaths related to restraints because patients have not been appropriately restrained and the staff has not been appropriately trained. So it is very important that everyone is appropriately trained before either A, they use restraints, or B, try to put patients into the restraints. Never trust these patients or their families or friends, because it has been numerous cases where families and friends of these patients have brought in weapons for the patients to use. So make sure that you thoroughly search the patients. Make sure that you thoroughly search the patient's belongings to assure that they are not bringing in concealed weapons into any of these psychiatric facilities. And the best treatment to control agitation or aggression, especially in the emergency situation, would be to use antipsychotic medications. And if preferable, use the short-acting intramuscular antipsychotic medications to help with these patients' behavior.